Hi there, I am Dr. Ahsen Nazir Ahmed. By the way, it's early morning time and I am a member of the 5 a.m. club. I get up early in the morning, I am an early bird, going to bed early, getting up early, little self-talk, little journal writing. By the way, today we are going to talk about the breast awareness program. First, I'll talk about the symptoms of breast disease. If a male or a female has these symptoms, he or she must visit a doctor, a general practitioner, or a surgeon. The three important symptoms of breast disease are breast swelling or a lump, discharge from breast of any color in the liquid form, and breast pain. Breast lump is normally or usually detected accidentally by the patient or by the person when he is hit by something on the breast, usually the females, or when they have pain. But there is an important concept of breast self-examination. If you go to a surgeon, he will teach you how to do a breast self-examination every month. In the studies, it has been shown internationally that people who do breast self-examination routinely are more liable, more likely to detect the breast lump. The important concept of breast self-examination is that it is done on a date usually set by the patient every month. Now, many years ago, I conducted a study. By the way, I've been running breast clinic and breast awareness program for the last 15, 16 years uh, here in Pakistan and also internationally abroad. And there are a lot of patients who come to you with a breast lump or a swelling, which is very late presentation. It has been there. Sometimes they even have noticed it. Because of the social taboos or modesty, they don't go to the doctor. This is not good. When the patient, as soon as he or she has any of these three breast symptoms, breast pain, liquid discharge from the breast, or the breast lump, immediately, there and then, the patient must go to the doctor. The breast lump doesn't always mean that it is going to be a cancer or malignancy, but anyway, by the way, it has to be investigated. When I conducted a study between the final year medical college students and the house job interns, it was seen that the knowledge of breast self-examination was more among the doctors who were interns in their first year of practical life as a doctor. But the practices were less than the final year students who had more practice but less knowledge. So activism is important. Once you have the knowledge, once you have concept, you must act on it. I mean, it's not good if you know how to do it, when to do it, but then you don't do it. It has been said, it's not true, but it is commonly said that every lump in the breast is malignant until proven otherwise. That doesn't literally mean that, but what it means is that when there is a breast lump, it must always be consulted or it must always be investigated. The second symptom is breast pain. You see, the breast pain can be of two types. Either it is in the females, it is like that when there is a monthly cycle, reproductive cycle, sometimes it comes with that. That is called as a cyclical mastalgia or the breast pain. Mastalgia, by the way, is the breast pain. And second is the non-cyclical mastalgia that is due to bones, ribs, any other thing, maybe muscles. These are benign things, but the important thing is that when sometimes some patients have so much of pain that they are not able to carry out their daily activities, routines. So if you have a cyclical mastalgia or a non-cyclical mastalgia, you must go to the doctor. There are medications available, very simple, very economical, can actually treat you. We are not the means, we are the tools. The means of treatment is, or means of giving the health is the divinity, but we are the tools. We have been given the knowledge by the divinity, by the colleagues, by experience, which we use to become a tool or to be a tool. That's fine. Non-cyclical mastalgia or cyclical mastalgia or breast pain is one thing, but sometimes in malignancy also you have a pain. So whenever a patient, male or female, has breast pain, he or she must actually go to the doctor. The third symptom is a discharge. Some people have white discharge, some people have green, different colors. But the important thing is, sometimes there is a blood discharge. But the important thing is that whenever you have these three symptoms, I will emphasize again, breast pain, liquid discharge, or a swelling or a lump, a doctor must be consulted. The second thing which I wanted to talk about was the concept of sentinel lymph node biopsy. You see, if a lady or a man has been proven that he has a malignant breast swelling or he has cancer, the important thing is we stage the cancer. I mean, we need to know it is stage 1, stage 2, stage 3, or stage 4. The staging is important because the treatment depends on the staging, and also the chances of good quality and quantity of life are also dependent on the stage of the disease. So if a patient comes to the doctor early when they have these three symptoms, the chances of quality and quantity of life to have more life, more quality of life are more. This is pure science. So when we have a malignant tumor or a malignancy or a cancer or a swelling which is malignant, we tend to either partly remove the breast or totally remove the breast. But that is not all. We also have to clear the armpit. There are lymph nodes which are filters, which filter infection and which filter malignancy from the swelling, and they are drained to the armpit. So we have to remove the armpit. We have to remove the lymph nodes from the armpit. This is called as axillary clearance. So what we are doing here is, our team, we don't remove the entire lymph nodes. There are actually 21 or 25 sometimes lymph nodes. What we do is, we do a sentinel lymph node biopsy. Either we inject a blue colored dye, mixing blue into the tumor or the swelling, or we do it radionuclide imaging. What I mean is that we actually pick up the first lymph node which receives this infection or the malignancy from the tumor or the swelling, and we take out that lymph node and we call or request the pathologist. He or she sees it under the microscope and they tell us that this lymph node has malignancy or it doesn't have malignancy. Suppose a patient has a swelling in the breast, but he or she doesn't have a malignancy in that lymph node, which is called as a sentinel lymph node. This sentinel lymph node is the first lymph node which receives the lymph or the fluid from the tumor or the swelling. If that sentinel lymph node is cleared by the pathologist, there is no need. I repeat again, there is no need to remove the lymph nodes or to clear the armpit. So this is a very important concept because it saves a lot of morbidity. You see, a bigger operation is avoided. This is the concept of sentinel lymph node biopsy. We are doing it. We have been doing it here in Pakistan and abroad. We have a pathologist. We have a team actually. The radiologist, the pathologist, the oncologist, the physiotherapist, the psychologist, and sometimes the plastic surgeon. Basically, I have been trained to do the reconstruction of breast, but I don't do it. What I do is the disease burden. Basically, I am looking after the disease burden of the breast, and this is what I propagate in the breast awareness program. But our team has one component, as our team as one component has all the facilities which the patient needs or which are required for the patient. Somebody wants a reconstruction, like say the breast is removed and he wants to have a new breast, So we'll call the plastic surgeon, request the plastic surgeon, and he will make a reconstruction of that area. So what I mean today, what I want to convey the message, is today's message is if you have these three symptoms, breast pain, swelling or lump in the breast, or any kind of a discharge from the breast, kindly, please, don't ignore it. There are many surgeons here in Pakistan and abroad, wherever you are in the world. If you are listening to this, we block. Don't ignore. Tell, propagate, educate the people. And I'll tell you one thing. Okay, it's fine. There are certain ages in which breast cancer is more. But personally, our team has operated on a 13-year-old girl who had an advanced stage breast cancer. And our team has also operated on an 84-year-old lady who had a breast cancer. So the important message is, when you have these symptoms, these three symptoms, kindly don't ignore them, because if this disease or if this problem is detected early, we are able actually to catch it in the early stage. And then, as I said earlier, the quality and the quantity and the cost of the treatment is less. Good luck for the day.